Welcome back, 912. Patients taking the popular weight loss drugs Wegovy and Ozempic are reporting an unusual added benefit. It's helping with other addictions that used to rule their lives. Users have claimed their cravings for cigarettes and alcohol became less intense, and that bad habits like biting their nails, picking their skin, and compulsive shopping have actually disappeared. Joining me now to weigh in on this is endocrinologist and obesity medicine specialist at Northwestern Medicine, Lake Forest Hospital, Dr. Disha Narand. Thank you so much for joining us this morning. Good to see you again.
Good to see you. Thanks for having me.
So this is really interesting. This just came out saying, it's having an impact on addiction. So has the medical community by chance stumbled on a new anti-addiction drug? What's going on here?
Yeah, a lot of this has been anecdotal from patients, that a lot of the impulses to consume alcohol or other types of things has decreased, right? And so it does make sense, because food also interacts with the reward system, and so do various things in addictions. And so we've had studies in the past where if you have an MRI looking at the brain, the same part of the brain lights up when we consume various fats and carbs. Same part lights up when we, potentially take something like cocaine or alcohol. So that reward system is very, very similar. And, there's still ongoing studies. So we don't have, all the understanding about this, but I think that there is some potential here. The other question is there long-term efficacy of these medications to fight addiction? And so that's something that remains to be seen.
Okay, so now I have to ask you this, because this might be another attractive reason for a lot of people to look into this. I was surprised to hear that an estimated 1 in 60 U.S. adults are already on one of these prescriptions. So do you see this number increasing? And once you go on, you have said before, for diabetics, you're going to take this for the rest of your lives. What do you want to say about that?
Yeah, in terms of addiction, we don't, like I said, I don't think we know what the long-term effectiveness of this is going to be. Is this going to be a long-term therapy to treat addiction? Is this going to be short-term? We just don't know yet. And so we need more studies to find out about that. But in terms of more and more people taking these medications, yes, I do think that that's going to grow. If we look at the obesity epidemic, the number of people who are affected by obesity is certainly not getting less. So I think more and more people are going to be on these medications. Right now, our greatest rate limiting step is certainly the supply issue, but then also insurance coverage.
Yeah, okay, so let's talk about this, because these drugs, they're changing the way obesity is treated currently. They truly are game changers. I understand there's more in the pipeline, even a pill form that might be more effective. So the reality is, people who are not obese and want to lose 10 to 15 pounds, they're also on this. That is the reality. Is that a bad thing?
I mean, not necessarily a bad thing, right? Because 10 pounds for somebody might be very, very significant in their lives versus, 75 pounds for somebody else. So we can't necessarily judge that part of it. I think the availability has been a big issue. And then also the longevity of treatment. So, for someone who might want to lose 5 or 10 pounds, they do need to understand that once they stop that medication, that weight may come back. And so is it worth it for the expense and the time that someone might need to be treated, to lose the 10 pounds? Now, that's going to be up to the patient and obviously the discussions with their doctor.
Yeah, well, so many other questions to ask you, and I know you and I are working on doing some stuff later, but we do appreciate you joining us this morning. Dr. Narand with Northwestern Medicine, Lake Forest Hospital. Always good to see you. Thank you.
Thank you, Sylvia.
You take care.
Take care.